Hi everybody, Dr. Jody Kinney. This is my patient Ann. Ann is 21 weeks pregnant and she has been getting adjusted since way before she was pregnant, and then with her other son over there, her entire pregnancy. So we always treat pregnant people because it's just such a great way to A, bring a healthy baby into the world, and also to maintain health throughout the pregnancy for a great labor and delivery. So these tables are great in that they drop out, so my pregnant mamas are able to get adjusted with the table dropped out so that the belly can lay right in there. So go ahead on your belly for me, Ann. So we always want to maintain the health of the pelvis, make sure that there's no subluxations or misalignments in the pelvis. She is a little off on the left side, so the table helps lifts and drops, leveling this pelvis exactly where we want it to be. And then I'm going to adjust the middle part of her back, because as the belly expands, we get a bigger lordosis, and that lower back tends to put a lot of stress in this middle back spine. Are you feeling that? Good. Blow all the air out. Good. One more breathe in. Great. And then our tables do what's called flexion distraction. So opening up the spine, helping to take pressure off the nerves. This stretches out all the middle and lower part of the back. All safe and all easy ways to get adjusted. Safe for the baby, safe for mom. And all drug-less ways to manage things like sciatica and low back pain and middle back pain, pregnancy headaches, all naturally with chiropractic. So we see lots of sciatica and low back patients, especially as the pregnancy progresses and that belly gets a little bit bigger. Good, let's check the leg length. Perfectly even, love that. Okay, so Ann, you're gonna lay and face this way on your side. Bend the leg up. So I'm gonna adjust her lower spine this way. Good. One more this way. Nice. And right on your back, please. Not easy. I know. You're doing great. Ann has a lot of neck tension. She's been getting headaches. She sits at a computer a lot of the day. So she always has a lot of tension up in the neck and up her back and into the head. Good. One more. Excellent. Also during pregnancy, around 21, 22, 23 weeks is when your body, the pregnant mom's body, starts to release more hormones, one of them being what's called relaxin. Relaxin is a hormone that relaxes all the ligaments and the tendons around the pelvis, but to expand, to make room for the pelvis growing and the baby growing. But it relaxes all the ligaments and tendons of the body, so everything has a tendency to shift out of alignment during the latter half of the pregnancy, which is why it's so important to be adjusted. We always stretch. Sometimes these muscles tighten up, so we want to stretch, especially around the hamstrings, the lower back, the pelvic muscles. And that's it. Nice and easy way to keep our pregnant mamas happy throughout this whole 40 weeks of gestation. So if you know someone or if you are pregnant, then you need to be getting adjusted to keep your body nice and healthy and keep this baby, growing baby nice and healthy too. Thank you so much. Thanks for tuning in. We'll see you soon.